Hello, my name is Muhammad Atib Khan. I'm the student of Health and Social Care. I'm the group leader, and today our group presentation topic is mental health. Now, first I introduce my group members, which is Muhammad Atib Khan. I'm the group leader. Then Taiba Kausar, Tahirullah Chaudhry, Lobna Chaudhry, Pamida Begum, and Nadia Akil. Our group presentation topic is mental health, and the objective is define and explain mental health, mental and mental illnesses, principle for mental health practices, analyze your own experience, values, beliefs, perceptions, and feelings toward mental health, signs and symptom treatment, medication of mental health, key picture of common mental health conditions, and the conclusion in the last. So, introduction. Mental health is a state of well-being where a person can realize his or her abilities to cope with normal stress of life and work productivity. Mental health is a positive state in which one is responsible, displays self-awareness, and reasonably worry-free, and can cope with usual daily tensions, and is satisfied with the life. It's defined by Shivers 2002. Mental health and illnesses. Mental disorders affect nearly 12% of the world population. Nearly 450 million people can benefit from diagnosis and treatment. This is a survey of World Mental Health Report 2008. Each year, about 4.5 million Americans, adult approximately 18.2% of the total adult population in the United States, suffer from some mental illnesses such as depression, bipolar disorders, or schizophrenia. So these are the mental health, which is like my group members will explain later. Like the mental health condition such as like depression, anxiety, bipolar disorder, or anxiety, tension. These will explain by my group members. So now I would like to invite my group member Taiba Kausar. So she will continue her slides after me. Thank you.
Hello, my name is Taiba Kausar, and today our group presentation topic is the mental health. Now I would like to continue my presentation slides after my colleagues. So today there are guiding principles we should always remember when we support people with mental health needs. So we need to understand that every person is dignity and respect. Respect that they have the potential to change and grow. That all people share basic human needs. It is essential the member or the behavior is meaningful and can be understood from the person's perspective. By developing communication skills, mental health care can support the patient adopt, grow, and change through the therapeutic use of self to create a therapeutic relationship. Modern civilization has developed different strategies to support people living with mental health issues. Early civilization believed that mentally ill were possessed by devil or his demons. Another belief was that a foreign object with magical power or evil had entered the body by food, drink, or medicine. People who had violated the very strict and narrow social code of their community by breaking a social taboo or sinning were deemed to be mentally ill. Abnormal behavior was often defined and blamed on possession of the soul and mind by good or bad spirits. Religion beliefs were often the core root of the Organization Treatment and Recovery for Mental Health Illness. These beliefs held external sources as being responsible for mental illness and recovery, whereas modern approaches to support people with mental issue focus on facilitating patient to identify the issue and strategies.
Hello everyone. My name is Tahir Charlie. Today I'm group president presenting on mental health. I'll start by discussing the classification of mental health before moving on to some of the most common mental health conditions. Surge classification of mental health. The neurosis, usually the patient retains insight and orientation, experience deep distress and may commit suicide as depression. The psychosis, the patient is disorientated, deluded and lacking in insight. The dementia, progressive deterioration with loss of recent memory and deterioration of normal, commonly secondary to another condition, example stroke and alcohol. Common mental health conditions: anxiety, a mental health condition characterized by excessive, persistent and uncontrollable fear of worry. Depression, a serious mental health condition characterized by persistent low mood, sadness and a loss of interest in daily activities. Stress is a body and mind natural reaction to challenges, demands or threats. Eating disorders are serious and can be life-threatening. People with eating disorders are at high risk of any medical complication and mental health illness.
Hello, my name is Lubna Chaudhary. Today I will be discussing the science and components of mental health. First, I will talk about the science of mental health. So, some of the science consist of feeling sad or hopeless for a long period of time, excessive fear or anxiety, mood swings, withdrawing relation from family and friends, changes in activity or change in school performance, interested use of alcohol or other drugs, staying lonely and feeling isolated. These signs doesn't exactly mean that someone has a mental illness, but if the symptoms last a long time, then they should talk to a doctor or professional. Now I will explain the classifications of mental health conditions. Self-esteem. Self-esteem is the amount of respect and appreciation you hold for yourself. It simply refers to treating yourself as a close friend. When self-doubt replaces self-respect, you feel your worthiness and know that you have inherent value no matter who you are or you have been. Self-governance refers to the freedom of choice and the ability to make decisions for yourself. It simply means continuing one's direction and path through life by making one's own decisions. Growth orientation is a continuing drive to learn and grow. It simply means that this is always an opportunity for learning from experiences and mistakes. Tolerance of uncertainty refers to the ability to cope with unknowns. It simply means accepting that some things may be uncertain at times and that it is okay not to have all the answers. Mastery of environment is the ability to accomplish tasks and successfully complete challenges. It simply represents feeling confident and capable of managing the demands of day-to-day life. Reality orientation refers to seeing reality as it exists versus how one wishes it would exist. It simply means being grounded and honest about the facts surrounding a situation in order to effectively manage and overcome it. Stress management is about knowing effective methods to reduce stress. All these elements combined represent mental health. Thank you.
Hello, my name is Famida. Our group presentation topic is mental health. I would to continue my slide after my colleague. I will share four main facts about mental health. First fact, there are different mental disorder with a different presentation characterized by a combination abnormal thoughts, emotions, and behavior. There are many different mental health conditions. They are not all the sum each one shows differently. For example, how people see things, and feel, behave can change in different ways. Second effect, there are effective strategies for preventing mental disorder such as depression. We can actually prevent many mental health problems like depression. There are preventive ways and strategies to stop these issues from starting or getting worse. Third fact, access to health care and social services capable of providing treatment and social support is key. Getting the right help is very important. People need easy access to health care, proper treatment, and social support to get better and stay well. Fourth fact, to the burden of mental disorder continue to grow with the significant impact on health and major social human rights and economic sequences in all countries. These issues affect people health, daily life, and economy in every country around the world. Thank you.
Hello, my name is Nadia Akil. Today our group presentation topic is mental health. Now I would like to continue my presentation slides after my colleague. Treatment of mental health depends on the person condition and needs. It involves the following approaches. Conductive behavior therapy helps change negative thinking patterns and behavior. Interpersonal therapy focus on improving relationships and communications. Psychodynamic therapy explore how past experience influence current emotions and behavior. Family or group therapy involves family members or peers of support and share learnings. Medications. Medicines may be prescribed by a doctor or psychiatrist to manage patient's symptoms. Antidepressant used for depression and some anxiety disorders. Anti-anxiety help reduce anxiety and panic symptoms. Antipsychotics used for conditions such as schizophrenia or severe bipolar disorders. The mood stabilizers help control mood swings, especially in bipolar disorder. Most effective medication is when taken as prescribed and monitored.
5 minutes. So this is the end of our group presentation, mental health. Thank you.